Have you ever finished a visit, sat down to chart, and thought, oh, where do I even start? I get it. I've been a home health nurse for over 10 years, and the thing that stresses everyone out, writing notes that actually survive an audit. Today I'm going to show you a 5-minute note structure that works for skilled nursing, protects your license, and keeps Medicare happy. It's simple, it's repeatable, and yes, it works even when your day is really crazy. Step number 1 is start with what you observed. Vital signs, wound appearance, mobility, mental issues, whatever is relevant for this patient today. Key point on this is write objective observations, not just patient doing well. Take this for an example. Patient ambulated 20 feet with moderate assistance, demonstrating improved balance compared to last visit. Try to think like a reviewer. What would someone who wasn't there need to know? Step number 2 is the skilled intervention. What you did that required a licensed nurse. Not just tasks, but skilled interventions. Example, wound care with assessment for infection, patient teaching for dressing changes, IV therapy monitoring, medication adjustments. And as an extra, add why a nurse was needed and not just what was done. Step number 3 is the critical thinking aspect. This is where your professional judgment shines. Why did you make the choices you made? Why did this patient need skilled care? An example of this is because of compromised skin integrity and diabetes, patient is at high risk for infection. Skilled assessment required to monitor healing and prevent hospitalization. So clinical reasoning, it connects your interventions to measurable needs. Step number 4 is the patient response. Document how the patient reacted to your interventions. Did teaching stick? Did wound appearance improve or decline? Any pain, fatigue, or safety issues noted? Here's an example. Patient verbalized understanding of dressing changes. They tolerated the procedure well, and there was no signs of infection observed. And step number 5. Risk if the services stop. This is a huge one for Medicare reviewers. What would happen if skilled nursing stopped? And an example of this, without continued skilled intervention, patient is at risk for delayed wound healing or increased chance of infection or possible hospitalization. One sentence like this can really make your note defensible. Step number 6, plan for your next visit. End your note with a clear path. What's the goal for the next visit? The frequency? What you'll reassess? An example of this is next visit, wound reassessment, reinforced teaching, and monitoring for signs of infection. Visit frequency 2 times a week until wound shows continued improvement. So here's a wrap up. It's 5 minutes, 6 steps, audit-ready note structure here. And if you do this consistently, your notes will clearly show the need, the patient progress, and ongoing risk, protecting your license and your agency. Remember, it's not more work, it's structured thinking and telling the story Medicare needs to see. If you want, I have a free cheat sheet in the channel description. And we thank you for stopping by and look forward to seeing you in the next video.